My name is Gerard Sutton. I'm Professor of Corneal and Refractive Surgery at Sydney University. My role is Director of the course, and I am involved in the course content, and I've had a lot of experience in refractive surgery both clinically but also in research over the last 15 years. There are a number of other surgeons that are involved in providing lecture content and also involved in the online tutorials, which are an important part of this course. We've been oversubscribed for the last 2 years for the actual course, and I think that it'd be fair to say that the course so far has been exceeding our students' expectations. The course covers refractive surgery, so all elements of refractive surgery, both laser and also intraocular lens. And it's a remote learning course, and so the lectures are accessed online, but it also involves a clinical component and a workshop section. So what we're striving for is to have our ophthalmologists become familiar and feel confident with doing refractive surgery after the course. Within the discipline of ophthalmology at Sydney University, we realised that there was a need for the course, that most ophthalmologists, when they do their traditional training, were not getting any exposure or any experience in refractive surgery. And given that refractive surgery is probably the most common procedure performed from an eye point of view in the Western world, really that's a huge gap, and this course is aimed to sort of fill that gap. The course is ideal for any ophthalmologist who wants to add refractive surgery to their clinical practice. You have to be an ophthalmologist to actually to do the course, and we need to be sure that you have those basic skills before accepting people to the course. The study commitment is obviously self-directed. There are lectures every week, and there is also an online tutorial, and it is very important that the students partake in this tutorial. Part of their assessment will reflect the amount of time they spend on the tutorial, but the lectures are all set up and there will be 3 assignments per semester for each subject. There's a 2-week intensive component where we run workshops and wet labs, and all the students get the opportunity to try the lasers, to use the various microkeratomes, to be updated and have a feel for all the latest intraocular lenses that are out there. At the end of the course, what you will know is everything you need to perform refractive surgery in your practice, and that means everything from the types of intraocular lens to types of lasers, and also the surgical techniques that you'll be using during the rest of your clinical practice. I think the professional advantage is for any ophthalmologist who is capable of performing cataract and anterior segment surgery to add an extra level, an extra dimension to their practice and be able to offer their patients a more refined service.